Welcome to St. Agnes MEDITECH Provider Order Management Part 3, Admission and Transfer. In this session, we are going to review searching for order sets, suggested sets, nested sets, required orders, admission orders, resuscitation or code blue orders, transfer, and admission. Using the buttons under the Active Orders table, select Sets and Category. This will display all of the different categories of order sets. You can use the plus sign to expand a category to search for a set. Sets that are grouped according to the type of patient or situation that you would expect to use that set. Here you see two categories expanded. These sets are sorted in alphabetical order by category. Sets can also be searched for by name. Using the Type Ahead function in the search window, type the first few letters of the name of the order set. Some order sets have additional subsets attached as suggested sets. Here is an example. When using the ortho admission set, the users often find they use the joint replacement fracture set as well as the adult PCA set. Rather than searching for each of those sets, users can select the admission set and the fracture and PCA set at the same time. These sets will display sequentially when viewed. They have been designed to limit the duplication of orders in each set. Order sets have been designed with a standard format outlined by our order set governance group. The order set information is listed first, followed by admission orders, code status, isolation, and so on. Isolation and code status are an example of nested orders. These are subset orders. These subsets will be found on all admission sets and will always be structured in the same way. They can be expanded using the plus sign next to that section. Orders in a set may be pre-checked if that order has been identified as being used in the set 80% of the time. They can be unchecked. Other orders may be required checked, as seen in this code status order. The check mark is grayed out. This indicates that the user must always use this order. Required checked orders cannot be unchecked. Orders with the red Edit button have questions that you must answer to make it a complete order, as seen here with the code status order. Orders with red font indicate that they are duplicated. Here you see the order for Notify Provider is listed more than once. However, the parameters for each order are different based on the age of the patient. Make sure you review any duplicate orders to ensure you select the correct one. The Edit button on these items is blue, so no additional information is required. Every patient occupying a bed on an inpatient unit must have an order for admission status, either admit to inpatient or place in observation. If the person who is entering this order does not have admission privileges, they will be required to select a cosigner from the lookup list. Admitting providers will be required to cosign this order, which will be found in your e-sign queue. Use a lookup to select a patient problem that is a reason for admission. Every patient must have at least one problem documented. If the patient has been at St. Agnes in the past, you may see a list of active problems, and you can add these to the current visit by placing a check mark in the box to the left of the problem. This will add it to the problem list for the current visit. Use a Type Ahead search to look for a new problem. Once selected, it will display at the top section. Because this was entered as part of the admission order, it defaults to acute, current visit, and onset with today's date. Any of these can be changed. If these are problems that you often treat in your medical specialty, use the Add to Favorite buttons in the footer to simplify the search in the future. When you have completed adding problems, select the Save button located in the footer. The attending listed by admissions will default into the attending field. Please verify that that is correct. Team or service is used to identify residency groups that are following a patient. Accommodation or level of care specifies where the patient is to be treated. Select the rationale for inpatient services from the drop-down list. If you select Other, please specify a reason in the next field. Current code status always displays in the right-hand side of the patient header bar. Entering a new code status will change the old code status, so there is never more than one code status listed for a patient. Select the new code status from the drop-down list. When you save the new order, this screen will pop up. You must either complete this order, which will allow you to save the new order, or return to the screen and undo the new order and keep the previous code status. The transfer function should be used when your patient is moving from one level of care to another, or at times when you would be required to do medication reconciliation, such as admission. These may differ from one area to another depending on workflow. The transfer function allows you to review home medications and current orders all in one place, as well as entering new orders. Reconcile Meds allows you to view detail or add medications to the home med list. Please review it before you start to ensure that the list has been updated on this admission. Last updated indicates that nursing has reviewed these medications and documented the last dose information. Use the type ahead search to add additional medications if needed. After selecting a home med to add, specify that it is a reported med in the action column. Prescribers are defaulted to prescription writing. Save and return to the transfer screen. Review each order and select Continue on Transfer or Stop on Transfer. Use the plus sign to expand each section. ED medications should all be stopped and reordered on admission. Lab or radiology orders that are in process but not completed should continue since the results are still pending. Each active order must be addressed. Use these buttons to add sets, for example, admission or post-procedure, or add orders, non-meds, or add medications, or continue from ambulatory, any home meds. By selection of Continue from Ambulatory, you will be presented with this screen. Every med must be addressed using the radio buttons. Continue will order this med as an inpatient, exactly as it is documented from home. Edit, which will allow the provider to edit the home med. Replace by provider will change this med to a different med. Hold, which keeps this med on the home med list, but does not add it to the inpatient med list or change it. The next section are medications that are not kept in St. Agnes formulary, for example, combination drugs, or it may only be carried in one strength. In this case, you can specify that the pharmacy change this drug to one that is substituted, or you can change or replace it with something else or hold this med. When you have completed this process, then select the Save button. Any new orders entered from a set or individual orders or meds will be displayed in the new order sections added to the transfer. Select the Process Transfer button to complete the process. Selection of the green check mark labeled Hold will not complete your transfer orders. They will be filed as pending and will not be processed until you return to this screen. Let's select Process the transfer. Allergy, interaction, and duplicate checking will occur. Please review any warnings carefully and respond appropriately. This order review screen will be displayed. Review all orders and make any edits if needed, and then select Save. All orders that we address during the transfer process will be displayed here. Please review and enter your PIN to sign these orders. St. Agnes Healthcare would like to thank you for reviewing order sets, admission and transfer, and using MEDITECH Provider Order Management.